Hello friends, let us now learn some important points about the nodular thyroid disease. Actually, if you say a thyroid gland can, right? If you see the thyroid gland which we have been reading, this thyroid gland can manifest with nodules, either one nodule or many nodules or multiple nodules. So, this nodular thyroid disease is mostly present in 4 to 7% of adults in United States. In United States, it is present in 4 to 7% of population and it is more commonly affected in women than in men. Whenever we have exposure to ionizing radiation, this ionizing radiation will increase the incidence of either benign nodules of the thyroid, or it will also increase the incidence of malignant thyroid nodules also. So, ionizing radiation will result in 20 to in nodular disease in almost 20 to 30% of the population who are exposed to ionizing radiation. Then, USG for thyroid nodules is very important. So, on ultrasonography of thyroid nodules, one thing which you have to see is where is the thyroid nodule. So, you will have to see the location of the thyroid nodules. Whether it is present inside the thyroid, that means the nodule which is seen, whether it is in the thyroid near really, or it is present extra thyroid, that is outside the thyroid gland. This is one thing which you have to see. At the same time, you will have to see whether the thyroid nodule which we see, is it benign thyroid nodule or malignant thyroid nodule. Nodular disease is common, okay, and the nodules will result in malignant thyroid disease in only 1% of thyroid nodules. Only among all thyroid nodules, only 1% will turn into malignant, whereas the remaining 99% will be benign thyroid nodules. But what is our goal? So, if you see the thyroid nodules, among 100 nodules, only one nodule will be malignant. The rest 99 will be benign. Then why are we going to treat the thyroid nodules with maximum are benign? The main reason is to save this one malignant nodule, is to find the malignant nodule so that we can give early treatment to the patient and thus we can save the life of the patient. So most of them are benign. So the difference between malignant thyroid nodule and the benign thyroid nodule can be found out by a thyroid scoring can be given, and we can do a histopathological examination to differentiate between the malignant and benign thyroid disease with higher thyroid score. Then in the ultrasound we can find the extent of the nodule, extent of the thyroid malignancy or extent of the benign disease of thyroid can be found out. Then we can also find whether there is any residual or recurrent or metastatic carcinoma is present in the ultrasound of thyroid can also be found out. Then we can do FNAC by ultrasound guided. We have ultrasound guided FNAC is one of the best technique to get the adequate sample for fine needle aspiration cytology. Then we have percutaneous thermal ablation of thyroid nodules can also be done. Percutaneous thermal ablation of thyroid nodules, parathyroid or lymph nodes can also be done with the help of this thyroid nodular thyroid disease. Then, so these are the important things that you have to see when there is ultrasound of thyroid nodules. Then, in the nodular thyroid disease, we can have Either the hyperplasia or goiter can be present. So this hyperplasia and goiter we will learn in the next class. Thank you.